Well, happening today, more than 40 families are headed to Capitol Hill for Family Advocacy Day. They're asking lawmakers to pass the ACE Kids Act of 2015 to help children who rely on Medicaid. And today we're speaking with 6-year-old Madison Garrett. She is here with her friend. What's his name? What's your doll's name?
Snowflake.
Snowflake, with her friend Snowflake. Make sure we get that in. Her mom, Brandi. Brandi, good to see you.
Yes.
And the Children's Hospital Association's president and CEO, Mark Wietecha. It's good to see you as well.
Thanks.
Brandi, let's first, we know how hard Madison has fought to get well. Tell us about her diagnosis and her condition right now.
In 2012, at the age of 3, Madison was diagnosed with stage 4 high-risk neuroblastoma, which is a rare form of childhood cancer. And Madison went through a very, very tough fight to get to where she is today. She went through 9 cycles of chemo, radiation therapy, transplant, and experimental antibody therapy, and several other surgeries, etc., at Children's National Medical Center in D.C. under great oncology care, Dr. Holly Meany, Elizabeth Thompson, wonderful, wonderful care. And in March of 2014, after almost 2 years of fighting, she was finally declared cancer-free.
Wow.
So she just celebrated her 1-year anniversary of remission just before her 6th birthday.
Wow, hold it together, Mom. I know this is tough. I know this is tough. You know, I know your family turned to Medicaid as part of this. What kind of misconceptions do you think people have about Medicaid?
Medicaid is different from state to state, so there are many misconceptions. A lot of people think that Medicaid only is applicable to a lower income class. Actually, in my state, Virginia, you have to be the working class, because in order to qualify, you have to have a primary insurance before you can even get Medicaid as a secondary insurance.
Okay.
And so we didn't even think we qualified initially when we were given the application when Madison was deemed disabled. And so we kind of turned our heads and said we probably won't get it. But there are a lot of children with critical illnesses that require a lot of extensive care, and primary insurance just doesn't cover it all. And so families like ours are extremely dependent upon Medicaid services to supplement what the primary insurance doesn't cover in order to get through things like this.
Okay. Mark, you see these situations all the time. What's working, what's not working, and what's the message to Congress today?
Well, Medicaid is a really important program for children. And as we've learned, we've got 30 million children in Medicaid across the United States. The ACE Kids Act, and our message for Congress today, is for children who are truly ill and need to travel across state lines to other parts of the country. We need a program that facilitates that. The ACE Kids Act is really built for kids like the Garrett family. In addition, it is a program that provides, for the first time, national information. We can improve the quality of care, costs of care for these children. So it's an important element to making Medicaid work better for kids.
Madison, I want to ask you a question. You have fought so hard to get healthy, and you're such a beautiful girl. What would you like other children to know who are out there and maybe going through the similar kind of fight?
Well, that as you pray, God will give you a beautiful life, and you're strong and brave, and we need people to care to you.
That's wonderful. Thank you so much for being here today. Can I shake your hand? You're so sweet. Thank you very much. Thank you all for being here, and good luck today. We're all thinking of you today. So, and congratulations on the 1 year.
Thank you.
How exciting. So, thanks for sharing this. We appreciate it.